Hello, and welcome to another episode in this series where we explore phage technology and acne. I'm Yug Varma, your host. I'm a microbiologist. I have a PhD in bioorganic chemistry and microbiome research, and I've been doing microbiome research for 15 years. I'm passionate about phage technology, and I'm so happy to be joined by Jamie Restivo today. She is a board certified PA, an SDPA diplomate fellow, and the president of the PDPA in Pennsylvania. But wait, there's more. She is also faculty at PANP Emerge and at LEAP. And she's also the host of the Spot Check podcast. So check that out. Hey, Jamie, how are you doing?
I'm doing well. Thank you so much for having me today.
Yes, and thank you for your time and sharing your perspective. So, phage technology is sort of the new kid on the block. It is an emerging technology to treat acne. And one of the things that it does really well is sort of be a very targeted solution for the overgrowth of C. acnes, which we know is one of the four pillars of acne pathogenesis. So can you tell us sort of how you see phage technology fitting in the treatment of acne, and both in mechanistic as well as kind of therapeutic or clinical terms?
Sure. So I would position Phyla as more of an adjunctive therapy. It would not supplant the need for other medical therapies for which we have strong data, as it ultimately fails to address all of the four pillars of acne pathogenesis. Ultimately, most patients are on a multitude of therapies so that we can address all four pillars and we can control and optimize their disease while minimizing their side effects. I think Dr. Christopher Bunick said it best in one of his most recent publications with the Dermatology Times. In terms of acne therapeutics, this is a chronic inflammatory skin disease, much like atopic dermatitis, where in acne we have immune dysregulation, we have barrier dysfunction, and we have microbiome disruption. And these microbiome-based therapies that have the ability to modulate the inflammation while reducing our reliance on both short-term and long-term antibiotics are really needed in our treatment paradigms. So these probiotic, these phage therapies, they can help to modulate the skin microbiota and maintain skin health, and that's helping to fill a major gap in our treatment armamentarium.
Yeah, and I think that microbiome products are obviously something that's a very exciting frontier, not just in, dermatology, but in other fields as well. I think microbiome products have been pushed further, like the research has gone further in gut microbiome studies and gut microbiome products. But are you aware of other sort of microbiome-based products for acne or any other dermatological treatment?
More prebiotic and probiotic therapies harnessing, maintaining the skin barrier, not trying to disrupt that, because as we know, many of the therapeutics that we have for acne, they have potential side effects in terms of redness and irritation, inflammation, retinization, especially when we're onboarding these therapies. So I often use gentle cleansers, moisturizers, things to help maintain that skin barrier and help to minimize the side effects from our other well-known treatment options.
So we've discussed how phages and phyla can be used as adjunctive therapy. I wanted to ask if, in your experience or in your estimation, there are certain mainline therapies that phyla is a particularly good partner with, or if there are certain subsets of acne or subsets of patients that you would recommend phages for over others.
I think there's a lot of flexibility with the phage technology. So it's very well tolerated in the clinical study. We can use this as adjunctive therapy for any acne, essentially. All acne is inflammatory. The clinical study involved both in inflammatory and non-inflammatory lesions, so comedonal, papules, pustules. So I think there's good flexibility to integrate it in really a vast patient population. The study ages were restricted. There weren't any pediatric patients. So that would be something that we would lean on in terms of discerning which patients would be good candidates for this therapy. But I don't see any really strong exclusion criteria. We just don't know the effect in those intending to get pregnant, those that are pregnant or breastfeeding, because those individuals were excluded from the studies. But I think based on the tolerability, the unique mechanism of action, it can be easily integrated into any treatment protocol, especially for those individuals that may be more resistant to use topical or oral antibiotics, or when in those instances that would be inappropriate.
Yeah, I mean, I think that's really insightful. And speaking of the side effects, obviously a lot of acne medications, side effects are concerned not just for the provider, but the patient as well. Can you sort of tell us a little bit more about concerns that patients have? Like, what are some of the top concerns that you see coming up over and over again? Yeah, how important is it for the management of side effects, both from your side and from what the patient sees in terms of like choosing an option for their acne treatment?
Side effects are really important for the clinician and the patient alike. So, a lot of my patients will bring up that they're scared of a purge, or maybe they've tried other therapies and they've had redness or inflammation or scaling. These are really deterrents for many patients that are reluctant to pursue topical therapies like topical retinoids, which are really the heavy lifters in terms of acne. They do so much in terms of preventing and treating active acne, going after the post-inflammatory pigmentation, scarring. So they're integral to the treatment paradigm. But there's a lot of resistance reluctance, I would say, in terms of patients, in terms of the purging that can ensue after initiating these therapies, and some of the side effects that occur, especially within the first week or two of initiation, and then the patients get acclimated to the therapy.
Yeah, I mean, that's important because I feel like the newer, the teenagers now and even young adults, from what we've learned, have this very sort of central consideration that they don't want something, that they're not in it for the short-term gains, right? They want kind of long-term skin health, and so they're I think more and more aware of the side effects of medications, not just acne medications, but all medications. And they're like, okay, doc, is there something else that you can provide me that doesn't have that profile, right? That is gentler on my skin, because they know that they may have to pay a price later on.
Patients are very savvy.
Yes, and I would say that they're, as skincare consumers, or kind of as consumers in general, they're the most informed they've ever been. Obviously, we've had the internet at our fingertips. There's been, now you can ask ChatGPT anything. But and I'm sure sometimes that's a headache for you, where you're like, oh, you've read too much, but it's too shallow. You need to dive a little deeper.
There's good information and there's misinformation, but yes, consumers, patients, they're very savvy. They know kind of what to expect. They know what they're willing to take on, what side effects they're willing to accept. And, there's lots of patients that want that instant gratification. And things take time to work. And most people, like I said, they're on multiple therapies, so it can be fatiguing. But I think this is a nice addition to our treatment armamentarium. And I'm interested to see, larger studies and more peer-reviewed studies that can substantiate this product and how we can best integrate it into clinical practice.
Yes, in fact, we are excited I think you had asked a question last week, and that is one of the big questions that we want to learn about, which is sort of the long-term effects of supplementing your microbiome with phages, because we know that phages live on the skin of healthy people and are much more abundant on healthy non-acne skin than they are on acne skin. And because they feed and kill C. acnes, which is the major bacterial etiological agent of acne, there is kind of this mechanistic link as well. So a big question for us is, how long does it take for the phage to stably engraft into the microbiome, right? And so that you don't have to take phages anymore. You're free. It lives on your skin and provides this benefit.
That's
So
fascinating.
it really is, and this is actually research that was concurrent with when we started doing research. So it came from a different lab, and we were surprised to see that kind of phenomenon. My personal opinion is that you will probably find more disease states where phages are coincident with health for certain chronic conditions.
Hmm.
There's actually things that even beyond dermatology, I've had very interesting conversations with like scientists and microbiologists and microbiome researchers where they've
Hmm.
said, "Oh, I'm seeing these interesting dots," and I'm like, "Okay, from what I know with acne, I think I can connect the dots, maybe not with a solid line, but with a dashed line." So those are bits of kind of curiosity for me. But to your point, it's something where you have a hypothesis. The only way to claim it or to show it is to do a study, right? And so we
Hmm.
want to do kind of more of those and publish them in peer-reviewed publications. So in the field of acne research, obviously there hasn't been a ton of innovation in the last 40 years, right? I think Winlevi is the first novel drug to come out in more than 40 years. What do you think is the impact of like phage technology or really any new impactful innovation in acne? Because I feel like providers have a limited toolkit, right? And acne is still the most sort of widely spread dermatological condition that providers will see on a daily basis. So what does that mean to kind of the dermatologists, the PAs, and the providers in terms of getting another tool in their toolkit?
It's really important. I think we have so many therapeutics now that we can target all four pillars of acne pathogenesis. Again, most patients are going to be on multiple therapeutics at once in order to achieve that. But I think there's really a lack of data in terms of the skin barrier dysfunction. That's a gap that needs to be filled. And again, we try to fill this with synergistic products in terms of cleansers and moisturizers and prebiotic skincare products to help to fill that gap. But there's really a gap where we're just not seeing as much innovation as we're seeing in other chronic conditions like atopic dermatitis and psoriasis, hidradenitis suppurativa, vitiligo. I think it would be interesting to see more biologics in the acne space, and again, therapies that are focusing on restoring the microbiome, not disrupting it, that are also very well tolerated and that we can integrate with other therapies.
Is microbiome disruption something that comes up at all in your discussions with patients on
All the
acne?
time, we use topical antibiotics. There's triple combination therapies now that we have. We've had dual combination therapies for some time. We use oral antibiotics. Certainly, we have to be good stewards about oral antibiotics. And one of the biggest issues that we have when we initiate these oral antibiotics, the way I position it to my patients is at least that, hey, we're going to put out the fire. We're going to settle down the inflammation while your topicals can take that time to get effect. But the stark reality is when we take those antibiotics off, that acne causing bacteria resides on the skin, the population is going to rise again. So we're not really addressing the problem long term. So we're initially shutting down that inflammation, allowing the topical therapies to take effect. And some patients may do very well on topical therapy alone. And there are a vast majority and subset of patients that may need other hormonal therapies, oral birth control pills that are combination, provided no contraindications, oral spironolactone, things like isotretinoin. So there's a lot of innovations left to be had in my mind for acne. I don't think we have the magic bullet. We have a lot more than we've ever had, but it's very stagnant. We've reached kind of a treatment inertia, sadly.
Yes, and we've had that treatment inertia for many decades now. So I think it's high time that innovation in acne is taken seriously and pushed forward. Obviously, phage technology is something that we're focused on, but it's something that I think, if it's part of a larger mosaic, then so be it. I highly encourage it because really at the end of the day, I think everyone is aligned that we want our patients to get better and we want them to have the right, we want providers to have the right tool to give to them, and the patients to say, oh, okay, this gave me the result that I wanted.
Mhm.
Well, on that note, obviously, we're at the beginning of a very exciting time when phage technology is making an impact in acne, but hopefully there's other research and other innovations in acne that are waiting to come out. So thank you so much, Jamie. This has been a delight. And thank you, everyone, for listening to this latest in our podcast series. And I will see you again soon.
Thank you so much for having me.